Hi everyone, my name is Dr. Frankie. I'm the Health Expert Ambassador for FemFresh. In this video, I'm going to delve into one of the most taboo topics, and that is vaginal odour. Since working in this role with FemFresh over the past 12 months, this is definitely the topic that starts up the most conversations and kind of splits the most opinions. So let's get straight into it. If you've watched any of my videos before, you'll know that I've spoken a lot about the vaginal and vulval microbiome. This is a unique population of bacteria, fungi and other organisms that all live in harmony to maintain the healthy barrier on the skin by maintaining an optimal pH. Now, the skin on the vulva and the vagina is maintained slightly more acidic, and that is kind of as a protective defense mechanism against any external factors that could try and enter. And as I've mentioned before, the vaginal canal itself is self-cleaning, so it produces this thin discharge which you produce on a daily basis to kind of flush everything out from the inside out. Now, that discharge and the slightly acidic pH, along with sweat glands that are on the skin, are going to mean that your vagina naturally produces an odour. And some vaginal odour is completely normal, and I really want to reiterate that fact because I know that vaginal odour can be a bit of an insecurity for many women, and I really want to reassure you that some vaginal odour is completely normal, and it's important that you get in tune with your body and learn what is normal for you. Now, sometimes when the pH of the intimate skin gets disrupted, so it gets knocked off that perfect balance for many reasons, whether that be excessive sweating, menstrual blood, sex, change in diet, stress, lots of reasons. If that pH balance gets knocked off, it can result in a change in odour. Now, one of the most common reasons for a change in pH and therefore a change in odour is an infection called bacterial vaginosis. Usually on the intimate skin, the population of the microbiome is kind of dominated by this lactobacilli population of bacteria. And sometimes when that pH balance gets shifted, it can mean that other organisms are allowed to grow and that balance gets shifted, and this can be an infection called bacterial vaginosis. It is so common, something we don't speak about too much, but I guarantee someone you know will have had it. BV itself is not a sexually transmitted infection, it's more of an overgrowth of one of the normal commensal bacteria that lives on your skin, but is normally suppressed by the lactobacilli bacteria I mentioned before. So whilst BV isn't an STI, it is more common in women who are sexually active. Some of the symptoms of BV is that you might notice a change in odour, so it becomes a more fishy smelling odour, and you might notice that your normal vaginal discharge turns to a more thin grey discharge. It's really important that if you notice a change in vaginal odour and something doesn't seem quite right to you, that you get some medical attention, because BV is very easily treated with antibiotics. Here at FemFresh, we absolutely don't want to perpetuate any female insecurities about feminine hygiene or odour. Some odour is normal, and we absolutely want you to embrace that. But we understand that when the pH gets disrupted, perhaps due to something like bacterial vaginosis, that change in odour can be an insecurity for some women, and they often want to speed up the treatment. Whilst you're being investigated and treated for any possible infections such as bacterial vaginosis, FemFresh Odour Eliminating Gel might be a good solution for you to help you restore the normal pH balance of your intimate skin and help speed up eliminating those unwanted odours. Of course, that product should only be used alongside standard of care bacterial vaginosis treatments, and it's not a substitute. But if you've been checked for infection and everything's healthy down below, then please embrace your odour and don't try and wash it away. The vaginal canal itself is self-cleaning and you don't need to interfere. We are certainly advocates for women having a choice on how they wish to approach sensitive topics like this, and we absolutely understand that lots of people will have an opinion on whether they wish to use additive products such as that. I hope that's cleared up what's normal when it comes to vaginal odour, what you shouldn't be worried about, and perhaps some of the symptoms that should prompt you to speak to your doctor. My name's Dr. Frankie, and I'll see you in the next video. Bye now.